I didn't believe what we were doing was going to make a big difference.
After a motorcycle accident in 1983, Ken Nelson just accepted that he would be in constant pain for the rest of his life.
It shattered my left leg, broke my jaw, and broke my back in 2 places.
After a month in the hospital and dozens of surgeries, his broken jaw would become one of the most painful and challenging parts of his recovery.
I didn't want to eat, and it was excruciating pain.
Nelson had an artificial jaw put in on the left side of his mouth, but even after that surgery, he could barely chew.
That's very annoying when you take a bite and it's like electric shock in your joint.
What was unique about Ken is this prosthesis here, total joint replacement. You have one joint that moves like a joint and one joint that moves like a mechanical joint, and that's what the issue was for him. And it's a very complex kind of muscular reaction that you have to balance out, because it would be like having one artificial joint on one leg and normal on the other, but tying your feet together. That's why he struggled for so many years, because nobody really addressed the fact that it's a very delicate problem here. It's an issue of two things that function very differently.
Dr. Michael Lebowitz gave Nelson an appliance to align his bite and adjusted it slowly over the course of a few years.
When Dr. Lebowitz started working with me, things started to change a little bit at a time, and the more we did, the more pain went away.
Once he started noticing changes and he started noticing improvements, that's what worked for him, and that's what kept him coming back to the next appointment. And there were many times he'd sit there and said, I don't believe this is going to work, but I'll let you try it.
Now I don't even have hardly any pain when I chew. Dr. Lebowitz and I both know that he changed my life, and he's a miracle worker.